Is berberine the new metformin for type 2 diabetes? This question has been buzzing around lately, and for a good reason. With the rise of natural alternatives in the health world, berberine is stepping into the spotlight as a potential game-changer for managing type 2 diabetes. But what exactly are berberine and metformin, you may ask? Well, metformin is a synthetic drug that has long been the first line of defense against type 2 diabetes, helping to lower blood sugar levels. On the other hand, berberine is a natural compound found in several plants, known for its anti-inflammatory and anti-diabetic properties. The beauty of berberine lies in its ability to mimic some of metformin's benefits, making it an attractive alternative for those seeking a more natural approach to their health. So, why is berberine being hailed as the new metformin? Let's delve deeper into this topic and understand why. So, what exactly is berberine, I hear you ask? Well, berberine is a compound that can be extracted from several different plants, including a group known as berberis. It's been used for centuries, if not millennia, in various traditional medicine systems across the globe. In the East, it's a staple of Ayurvedic and Chinese medicine, well regarded for its potent healing properties. In recent years, however, berberine has been making a name for itself in Western medicine too, as scientists and researchers begin to uncover its potential health benefits. Berberine is loaded with anti-inflammatory and antioxidant properties. These characteristics can support our bodies in fighting off various diseases and maintaining overall health. But what's really been catching people's attention is berberine's potential role in managing blood sugar levels, which is particularly relevant for those dealing with type 2 diabetes. Now that we know what berberine is, let's compare it to metformin. How does berberine stack up against metformin? That's the million-dollar question, isn't it? Well, let's dive into it. In one corner, we have metformin, the tried-and-true champion in managing type 2 diabetes. It has been the first line of defense for decades, known for its ability to lower blood sugar by reducing the amount of glucose produced by the liver. Metformin is a powerhouse, but it's not without its drawbacks. Some people experience gastrointestinal issues like diarrhea, nausea, and abdominal pain. Others may suffer from a rare but serious condition called lactic acidosis, particularly if they have kidney problems. In the other corner, we have the challenger, berberine, a chemical found in several plants like golden seal, barberry, and Oregon grape. Berberine is stepping into the ring with some impressive stats. It's been shown to lower blood glucose levels to a similar extent as metformin. It does this by increasing insulin sensitivity and promoting insulin secretion, which helps to regulate blood sugar levels. Multiple studies have shown berberine to be a potential alternative to metformin. For instance, a study published in Metabolism found that berberine was just as effective as metformin in regulating glucose metabolism. Another study in the Journal of Clinical Endocrinology and Metabolism showed that berberine could improve insulin sensitivity as effectively as metformin. But just like its opponent, berberine is not without its potential downsides. Some users have reported digestive issues similar to those associated with metformin. Additionally, berberine can interact with certain medications, so it's crucial to talk to your healthcare provider before starting any new supplement regimen. In the end, both berberine and metformin have their strengths and weaknesses. While they both show efficacy in managing blood sugar levels, they also come with potential side effects that must be considered. And remember, everyone's body responds differently to medications and supplements, so what works best for one person may not work as well for another. While berberine shows promise, it's important to understand that it's not without its downsides. So what are the downsides of berberine? While it's been hailed as a promising alternative to metformin, it's essential to also consider the potential drawbacks and side effects of berberine. Just like any substance you introduce into your body, berberine may cause some adverse reactions. Some individuals have reported experiencing stomach upset, cramping, and even diarrhea. These gastrointestinal side effects seem to be the most common, but they usually subside as the body adjusts to the new supplement. However, it's always wise to start with a lower dose and gradually increase it, giving your body ample time to adapt. Furthermore, while the immediate effects of berberine are encouraging, it's important to remember that we still need more research to fully understand its long-term effects. As of now, most studies have focused on the short-term benefits of berberine, leaving the long-term impact largely unexplored. Therefore, if you're considering berberine as part of your health regimen, it's crucial to keep this in mind and consult with your healthcare provider. Also, it's worth noting that while berberine is a natural compound, it doesn't mean it's free from interactions with other medications. Hence, Always discuss with your doctor if you're on other medications, particularly those for diabetes or heart conditions. Despite these potential downsides, many are still opting for berberine over metformin. It's a personal decision that should be made in consultation with a healthcare professional, taking into account your unique health circumstances and needs. So, is berberine really the new metformin for type 2 diabetes? Let's recap what we've explored today. We've delved into the world of berberine, a plant-based compound that has been used for centuries in traditional medicine. We learned that it has potential benefits for those dealing with type 2 diabetes, including the ability to lower blood sugar levels and improve insulin sensitivity, much like metformin. We also compared berberine and metformin, two powerful allies in the fight against diabetes. Both have their strengths, but they also have their differences. While berberine is a natural compound, metformin is a synthetic drug. Both have been shown to help manage blood sugar levels, but each has its own side effects and potential risks. We then touched upon the downsides of berberine. Despite its potential benefits, it's not a magic bullet. It can cause digestive issues in some people, and its long-term effects are still not fully known. It's crucial to remember that while berberine shows promise, it's not a one-size-fits-all solution. It's essential to stress here that, although berberine shows promise, it's vital to consult with a healthcare provider before making any changes to your diabetes management. They can provide a holistic view of your health and guide you to make the decisions that best suit your individual needs. Whether berberine is the new metformin or not, it's clear that it's an option worth considering for those managing type 2 diabetes. Remember, your health is in your hands, but you're not alone. Always consult with your healthcare provider before making any changes to your treatment plan.